Yeah, when you have young people, it will definitely give Zimbabwe. No? So that is basically why we have young people and why you have this session. So I would just want to say this year's theme is for the workshop is around out of the box for SRHR and HIV services. Out of the box for HIV services, for SRHR and HIV innovation for and by young people, by adolescents. So we definitely cannot have this session without having our inputs, and we want to grow outside the box. I mean, we have grown outside the box. So the workshop is mainly focusing on exploring the impact and the well-being of adolescents, and that's why we have this workshop, and the impact, basically the what is this? The sexual needs and the issues that are affecting young people, not when it comes to SRHR, when it comes to HIV. So I also want to, and we cannot explore this innovation without having the impact of young leadership that brought this innovation. So with this session, it's basically it was put together by the youth reference group members, together with the Y Plus Global, the network of so the network of young people living with HIV. To demonstrate the leadership and the hard work that we do as young people. So the session is to highlight the influence of us as community leaders, as young people, to advocacy. How we demonstrate our advocacy. So I would like to, without wasting, I would like to welcome Joyce. Joyce Ouma from Y Plus Global. Yes. So she's basically the advocacy and campaign officer at Y Plus Global. Thank you.
Hello, good afternoon, everybody. Good afternoon, everyone. You mentioned that you felt like you missed out on what was happening yesterday at the youth-only event. Well, we brought that to this room today, all right? All right? So as Lazarus mentioned that this session was put together by the Youth Reference Group. Please give them a round of applause. And the Global Network of Young People Living with HIV, Y Plus Global. Thank you so much. And thank you, Lazarus, for setting pace. Thanks to the icons who we met yesterday. And they just decided now that they wanted to give us a presentation. And they were like, we're not prepared. Turns out they were. So another round of applause for them, please. So as Lazarus mentioned, that this is the youth-led event. And the title of this session is Breaking Barriers. Youth-led advocacy leading change. Today, we are going to be having an amazing panel of young leaders from far, far away. You're about to see them. And they're going to be sharing with you some of their experiences, some of the lessons learned, and how they've been able to put young people at the center and also to be able to lead the HIV response. Are you ready for our panelists? Are you ready for our panelists? Our first panelist joining us all the way from Indonesia. Help me welcome Bella Aubree. A round of applause for Bella. So Bella works with Inti Muda, a network that works with the young key populations in Indonesia, which has done tremendous advocacy work to improve access to HIV service delivery for young key population. Welcome, Bella. Our next panelist is coming in all the way from Kenya. A round of applause for Ruele Okeyo. Ooh, Ruele has funds. Welcome, Ruele. So Ruele is a U equals U ambassador for Prevention Access Campaign. He's a young person openly living with HIV and is passionate about sexual reproductive health. He uses his passion and takes it upon himself to take ARVs in public places in order to help end the stigma people living with HIV face when taking ARVs. A round of applause for Ruele, please. Our next panelist is joining us all the way from Namibia. Namibians in the house? Namibians in the house? Please help me welcome Ndiilokelwa Nthengwe from Shut It Down Movement in Namibia. A round of applause for Ndilo. Thank you, welcome Ndilo. And next, we are heading to South Africa. South Africans in the house. Are there South Africans in the house? Please help me welcome Nyiko, Kubai. So Nyiko is going to keep walking until I finish Nyiko's profile. Nyiko was last year's local co-chair for the HIV and Adolescents workshop that happened in Cape Town. A round of applause for Nyiko, please. And finally, we have a young person all the way from the Kingdom of Eswatini. Help me welcome Progress Siyabonga. Keep clapping until progress comes. Great, thank you very much, everybody. And now I'm going to take my designated seat. This is a fancy one. Great, thank you very much, everybody, and thanks once again to our esteemed panelists for joining us today. We'd like to start by a quick round of introduction. I know I just mentioned one-line bios of all of you, so just to start from Bella coming this way, let's start from Nyiko. Please tell us your name and the organization that you work with, and some of the interventions that you'll be speaking on today.
Greetings, everyone. My name is Nyiko Kubai, based in South Africa, and then I'm affiliated with AfroCare Treatment Optimization. We are advocating for the most optimal drugs and quality drugs in sub-Saharan African countries. I'm also affiliated with Smart for TB. We are trying to develop the new investigational drugs and research tools for TB. I'm also affiliated with Tholulwazi, Phakathi, a psychosocial support organization that offers enhanced services to young adults who are living with HIV. And then lastly, I'm affiliated with the National PL-HIV sector of South Africa, engaging on the national level for these commodities and other issues that I've addressed. And then today, I'll be outlining the benefits of using long-acting molecules to address prevention and treatment. So stay tuned for more engagements. Thanks.
Okay, good afternoon, everyone. Selamat siang, that is a good afternoon from Indonesia. So let me introduce myself. My name is Aubree. I'm from Indonesia. I'm a young trans woman living with HIV. And now I am currently national coordinator of Inti Muda Indonesia. It's a national network of young key population in Indonesia, and also we work in advocacy, campaign, and so much more. Thank you. It's really nice to meet you all.
Hi, everyone. Hello. Hi. Fantastic. My name is Ruele Okeyo. I work with Y+ Kenya, which is a network of young people living with HIV based in Kenya. I'm also the director at Kenneth and Jacob's House, which is a shelter for homeless and runaway queer youth. I'm also a U equals to U ambassador for Kenya in Africa under the Prevention Access Campaign as well. And generally speaking, I am a content creator, majoring my content on HIV, drug adherence, and ending stigma for people living with HIV, and an icon for the queer community. Thank you.
this audible? Oh. Hi everyone, can you hear me? My name is Ndiilokelwa Nthengwe and I'm from Namibia. I'm a self-published author, a tech entrepreneur, and also the executive director of VCRC, the Voices for Choices and Rights Coalition in Namibia. I will be touching briefly on the reproductive justice clinic that we launched this year, and then also the digital studio that we are working with in Namibia. And then also, I suppose, the advocacy work that we are doing within Shut It All Down, within VCRC, and the intersectionalities between all of those threads. Thank you.
Morning, everyone. I mean, afternoon. My name is Progress Siabonga Pembe, a community secretary at Lubuli under the Safate Enhancing Child Protection Program supported by UNICEF. I am an SRH advocate and a mentor. I am also a social accountability monitoring champion who ensures that young people give feedback as how they receive services at Lubuli Clinic. Before the Safate application, young people at Lubuli Clinic will complain mostly about staff unfriendliness, which led to them shying away from accessing SRH services at the clinic. This led to a high number of unwanted pregnancies in the area, with the help of the application, I have seen an influence of young people coming into the clinic. Thank you.
Thank you very much. It's indeed a pleasure to have young people, young leaders, and I would love to start off with Ndiilokelwa. You have received I know your movement or your organization has received recognition for the work you guys do around anti-feminism and sexual gender-based violence. So my question would be, what would you want to say, or what either are the key strategies would you want to recommend for a young activist when it comes to that? Around work that or advocacy around anti-feminist and gender-based violence.
Okay, thank you. So I think I would like to start off with contextualizing where the Shut It All Down movement started and how it was founded. In 2020, when a wave of protests with Namibia's largest youth-led protest that took place. And this was actually as a result of the death of my cousin, who was found buried in a shallow grave. And so as a result, it triggered this big and this large protest, and I found myself later on at the storm of this protest. But over the years, and I think coming back and reflecting on that question on what young people need to be doing, is I would say that you should not put all your activism in one basket. I think that a lot of us, we just want to focus on one thing consistently over time, which is okay. But I think that you need to diversify, and diversifying is really key. And so we started off with the SGBV movement, but I've also been intersectional in all of my other advocacy-led activities within the sexual and gender minority spaces, within reproductive rights, etc. And so that has also given me much more of an open understanding as to where to really exert my energies. So I did mention that I'm a published author, so I write mostly, more than I'm protesting right now. But if you have the energy to go into the streets, that's also okay. That's only, I mean, it's really up to you. And then the other thing also that I wanted to say, the key strategy is leadership is really very important. We shouldn't just look at leadership at a high level where it is already institutionalized in other spaces. We as young people need to be the leaders in our activism and movement spaces in order to actually get ourselves and get an understanding of what exactly does it take to lead movements, to lead key initiatives, to program, to have program implementations, etc. And so leadership is really important. Leadership must come in front of your activism title, in front of everything else. Focus on how you can self-actualize as a young person in any given space, whether you're working within HIV, whether you're working within SGBV, reproductive health rights, etc. So that is what I would like to impart around those key strategies. Thanks.
Thank you very much. I think you mentioned leadership. It's quite important, and when it comes to young people, I think that you mentioned quite how young people can really be involved. I think did you also redefine what the leadership role? So I also want to say you in your work from Namibia, I have seen you guys demonstrate. How do you? I think my follow-up question would be, how do we as young leaders demonstrate freely without being in contradiction with? We can say we want really to showcase our voice, but at times we really find ourselves at the wrong side of the law. So I think what should be the advice when it comes to that?
So I would say we should not erase and invisibilize our efforts, especially as young people, because as I said earlier, that don't just cast all of your activism in one basket. And sometimes if you are at the forefront of a protest or a movement, people only see that and they don't see what is happening behind the scenes where everyone else is contributing. So if I'm on social media, that is also one other way that I can also advance and organize. And if I have other forms of abilities and other skills and talents, that is what I can use. But I also want to say that we should not just pedestal what people are seeing at the forefront. We should actually appreciate what everyone is doing in all of their capacity and skill sets. And that is also where the diversity question comes in. And everyone in this room, in any other space, really has the potential to contribute meaningfully. And so that's why we should not invisibilize. Otherwise, we gatekeep also our movements, and we make other people feel as if what they are contributing has no value, and that is actually not okay. So yeah.
Thank you for that. I think Ndiilokelwa, I think you have received a lot of hatred when it comes to like regarding the court case that you guys raised for the same sex marriage in Namibia. So I want to say maybe question what are some of the motivations maybe to give to young people, because a lot of us when we come up with something or raise awareness on something and then we receive so much hatred towards it, we become demotivated, we lose focus. So what will you what motivation can you give a young leader that is face the same hatred that you guys are facing currently or you faced?
Okay, so I won't necessarily touch on all of that political stuff that is currently ongoing in the country because it's still very sensitive. Mm-hmm. And earlier this morning, we were told that Zambia is a peaceful country. So you don't necessarily want to just be poking bears. Yeah. So I would rather start from the motivation aspect. And I think the reason why maybe I have come this far is because I did not decide to just go into an NGO space as soon as the activism started. You need to assess as a young person, once you've started a movement or you've joined a movement, is this something that you want to turn into something else? Is it an NGO? What type of NGO is it? Is it just going to be another NGO that you're going to be putting events for? Are you just going to focus on festivals? Are you just going to focus on this and that? So over the years, what we've done is Shut It All Down is going to become a political party next year. And then at the same time, with the reproductive justice movement, we formed a clinic. So we launched a reproductive justice clinic because we said, actually, we already experience a certain kind of backlash and stigma, especially as young people, from our healthcare service providers. And we said, let's actually go into the health sector and see whether this is just to compare, and weigh exactly whether our sentiments match with reality. And what we've learned is not only has that made us gain enough leadership experience, well, it's still ongoing, but still is that we are understanding now more that with our institution, we can actually do more now for young people. We are going out to different festivals. Our clinic is not stagnant, it's mobile. So we move around where the crowd goes. In fact, this week in Namibia, we're going to be part of Namibia's biggest festival, Kubai Festival. And that is actually where most of the young people are. We test everybody, we work with everybody. We provide contraceptives, HIV screenings, reproductive health counseling, and also other forms of reproductive health care. So you look at what your motivations are, and when you see that this is not working out for you, you have to pivot. Don't just stay in one space, because I think it's just a journey, it's just a lifetime experience. So that's what I wanted to say.
Thank you. Thank you for that.
Great. Thank you very much, Ndilo, for that. Very exciting insights from young leaders. I've heard putting leadership before titles, and thank you very much for sharing your own advocacy experience. Now we're going to head over to Ruele. Ruele, as a young queer person living with HIV, you have taken to social media to create awareness on HIV treatment, a good example of individual social media advocacy. What are some of the effective strategies in social media advocacy, and how do you handle the hate? I'll throw the same question back to you. Thank you.
Thank you so much for that, Joyce. And before I even talk about the hate, I'm going to talk about how we handle, or how I handle social media advocacy. And one thing that most of us in programming understand is the need for us to fill a gap, and that's the gap that I chose to fill. So I'm not going to get into context, but I'm going to talk about how my advocacy did land me on national news. And when I came out as a person who lives with HIV, one of the questions that I got mostly from my people was, how do I take my medication? And the follow-up question I would ask is, who are you living with? Do you have friends? Do you have family? Do you have brothers, siblings? Who are you living with? And most of the times I would get the answer, I live alone. So if you're living alone and yet you're afraid to take your medication, what does that say? And that's a gap that, needs to be filled, needs to be addressed. And that's how I decided to take my ARVs publicly, to show that if you are afraid of taking your ARVs in your house, let me be the one to take my ARVs publicly, so that you don't feel bad because you're able to not take ARVs in your house. So that's a gap I decided to fill, because oftentimes when we go to social media and look at what people do, we're either promoting a product, we're promoting a company, but no one is doing social media for good. We have turned social media to become a space where anything goes, but that's just not the case. What are you putting out and what are you receiving? And it is through my advocacy through social media that I personally, I have enrolled quite a huge number of people back into care, because I created a space where people can trust to come for both information and for linkages to services. So that is one thing that I did take pride on, by filling a gap that is heavily needed. Because if we lock ourselves up in offices and say that we are programming for things for people who are living with HIV without understanding the needs that the people who are living with HIV need, then we're just going to be talking about the same things, even when we are senior citizens. No offense to the senior citizens. So honesty is, again, a venture that we need to take, because I do something, it's very simple. To someone, it's very basic. Just taking my ARVs in public. And I get so much hate for that, because I have been told I am promoting HIV. I have been told I am not taking ARV medications. I am told I deserve to be HIV because I'm a queer person. So all that dynamics, we have to handle it in some way. And sometimes we choose the violent road, if I can call it that. But the best way we can go about it is look at things from that person's point of view. And from that person's point of view, it's coming from a point of unknown. So if we retaliate with the same energy that they're providing, then we are still circling in the same boat. However, if I am able to address and say, like, yeah, I am not promoting HIV, I am creating content for a HIV positive person who is afraid and cannot take their ARV medications because they are self-stigmatizing themselves. They have already anticipated stigma that is non-existent. They already feel that if I take my ARV medication in public transportation, everyone is going to know that I'm taking ARV medications. No one forgets we always have headaches. So if you have a headache and you take your medication, does someone say you're taking ARV medication? No, but what comes into our heads first that's a HIV positive person. So I take my ARV medication publicly to end the stigma, to end the shame. Yeah, no shame, to end the shame, you know? So, thank you. Thank you. Yeah, because personally I struggled with, self-stigmatizing myself so much, and I was becoming part of the problem, but I decided to take myself out of that, and by addressing that aspect of self-stigmatization, then we can be able to address the bigger picture.
Wow.
Thank you.
Thank you so much, Ruele. Thank you very much for sharing your personal story with us. I and many other young people living with HIV, thank you for your service, because we understand you've initiated the very hard conversations. You've stood in the gap and addressing the actual issues that are affecting young people living with HIV. So thank you very much. I'll hand back to you, Lazarus, for the abstract.
So we are going to have our abstract presenters. I would like okay. So it's not on. So we are going to have an abstract presenter focusing on ethical engagement on adolescent and young women in Global Fund, GC7. So the presenter is from Eswatini, Lesotho. So welcome. Who is our abstract presenter? Okay, yeah. You may please come to the stage. Sorry.
Good afternoon, everyone. How are we all feeling? I hope lunch was great. My name is Crystal Bonzo, and I stand before you as the Her Voice Fund Ambassador for Zimbabwe, but I'm also representing the other 4 ambassadors who couldn't join us for this special event. So I'm going to be talking about the ethical engagement of AGYW in Global Fund GC7 processes that happened in Zimbabwe, Lesotho, Eswatini, Malawi, and Mozambique. So the background is, we're all aware that Southern Africa has the highest HIV prevalence when it comes to adolescent girls and young women, and this creates increased HIV acquisition. And to also add on to this, meaningful and ethical, sorry, there's a glitch. The monitors are off, yeah? Awesome. So as I was saying, we're all aware that meaningful and ethical engagement of AGYW coupled with inclusive decision-making is critical to achieving the eradication of HIV in Southern Africa when it comes to adolescent girls and young women. So as I mentioned, I'm here with the Her Voice Fund, which is an initiative that deliberately invests in developing leadership capabilities of young women and girls so that they can be present, they can be heard and seen when it comes to decision-making processes, both in national and international forums. So our approach included the 4 things where we were very deliberate in working with adolescent girls, young women in leading the consultations, and this was led by the Her Voice Fund ambassadors that are not present at this engagement. It was data-driven to prepare adolescent girls and young women for consultations with engagements when it comes to Global Fund GC7 processes. The approaches were also representative and inclusive, and when we say AGYW in all their diversities, we literally mean in all their diversities. We were working with young women living with HIV, adolescent girls living with disabilities, young women who sell sex in their diversity as well. And then lastly, we used different participatory methodology, which included both cafe activities, role-playing, sticky notes, all the things that make it fun for young women and girls to be educated in an interactive way. So I'm going to be presenting the findings in the 5 countries. And the first one is Lesotho, where 10 districts were involved that were talking to AGYWs in their diversity, but this was conducted over a 2-day session. The workshops were interactive, and the agenda was to review the GC7 processes, educating the participants on how they can contribute. And then what was more exciting about Lesotho is we actually then made smaller groups that focused on young women living with disabilities so that they could also have opportunities to be in spaces that are inclusive and accessible. The lessons we learned there from Lesotho is that when AGY leaders are educated, equipped, they are able to participate in global fund fundraising processes, and they actually went on to be part of the proposal writing team. In Malawi, AGYW was engaged with local community-based organizations that provided education and access to HIV prevention resources. Key insights included gender-sensitive approaches that allow for AGY to make informed decisions about their health. In Malawi, the lessons we learned that combining HIV medical interventions with community engagement and education is key to eradicating HIV amongst AGYW. In Mozambique, we engaged 70 AGYW ages between 15 and 24 from 5 provinces with the support of the Her Voice Fund. We utilized the participatory method where some sessions were done in person and virtually. The insights were to ensure meaningful engagement of AGYW in GC7 processes such as accountability and grant-making processes. The lessons we learned in Mozambique was increased commitment to capacity strengthening and power sharing between adult decision makers, and AGY is needed to make collaborative efforts to end HIV amongst AGYW. In Eswatini, we conducted consultations with diverse AGYW using active participatory methods. And again, in Eswatini, we were able to have the team be present in the Global Fund request writing proposal. The lessons we learned in Eswatini is that meaningful engagement requires active participation in AGY, especially when it comes to programming. For example, having the opportunity of AGY participate in country coordination meetings. And in Zimbabwe, we engaged 25 AGYW ages 17 and 30. We used a participatory method where we were engaging with AGYWs, and our aim there was to provide background education on global fund processes and how AGYW can be involved. We noted that in Zimbabwe, the existing cultural and structural power sharing dynamics were a hindrance in completing some of the activities. The lessons learned in Zimbabwe is it is essential to provide learning education before engaging AGYW so that they are able to contribute meaningfully. Before I move on to the recommendations, I just want to pause everyone for a minute and stay with me. Imagine you're working, you're a student, and you're told last minute that you need to show up for a meeting, that you need to prepare the talking points, you need to prepare a presentation, and this comes at the 11th hour. I'm sure we've all been there, and when you show up, are you going to be effective? Are you going to be meaningfully engaged with the conversation? And if you don't show up, people won't take you seriously. So that was the issues when we were dealing with the GC7 processes, that there has to be a commitment to power sharing between adult policymakers and institutions when it comes to meaningfully engaging adolescent girls and young women. And then secondly, ethical engagement should not only include AGYW when it comes to national and international forums such as the GC7 processes, but it should extend further beyond the processes that are ongoing so that we can all end AIDS by 2030. I would like to acknowledge the following for making this initiative, this research possible. All the AGYW across the 5 countries I've mentioned for sharing their time, their perspectives, and experiences with us, the respective Her Voice Fund country ambassadors and country leads in absentia. I want to thank Her Voice Fund for investing in adolescent young girls and women for leadership opportunities. I want to thank Y Plus Global, the Global Fund, as well as UNICEF, ESARO. Thank you very much.
So thank you very much, Crystal. We are going to jump right back to the our panelist here, our wonderful panelist. So I want to start off with Nyiko. When it comes to HIV prevention, there's a lot of work that you have been doing. So I want to say, ask what are some of the ways or some ways to improve prevention when it comes to technology, long term, and their benefits.
Okay, thanks so much, Lazarus, for chairing the session and also your very brief question. So, long-acting technologies address a lot of issues that young people face, primarily adherence, and then as part of those, we try to integrate those models of adherence by trying to advocate for the long-acting technologies. For example, we have if we would recommend that young people or other aging populations should use long-acting technologies, it would be addressing the following benefits. We are facing pill fatigue, so when using long-acting technologies, there will be less frequent dosing. We also have a bioavailability of 100%. So if you take a daily oral pill, this is what happens to your immune system. You take your medication, and then the following day, the availability of the drug decreases in your immune system. But if you take long-acting molecules, the bioavailability of the drug shoots in a long period of time. So that's another benefit. And then long-acting technologies have less adverse events, less drug-to-drug interaction, and then it's even safe to pregnant and breastfeeding women. And then how can we increase the advocacy throughout the sub-Saharan African countries? So through the AfroCap initiative, we have technical team members throughout the African countries. For example, in South Africa, we have at least 9 technical advocates throughout the provinces where they advocate for these quality drugs from their different settings. So we tend to focus on treatment optimization, which focuses on the most optimal drugs like your long-acting molecules, cabotegravir for prevention, cabotegravir for treatment with relpaverine. And then we are also addressing issues around advanced HIV diseases, because we saw that it is becoming a sense of emergency. Those advanced HIV diseases like your TB, cryptococcal meningitis, and other diseases. So if we can try and get the UN agencies and other agencies to support the young people's initiative of advocating for the most quality drugs in the low and middle income countries, that would work the best, because we have old drugs, we can't lie around that. And then there's a high demand for the new long-acting technologies. Thanks.
Yeah, okay. Thank you so much, Nyiko. We definitely need a lot of advocacy when it comes to new drugs in African countries. So I want to jump right to Bella. You are doing a lot of advocacy when it comes to making sure that young key populations are accessing the HIV services. So my question comes in, what are the benefits of making sure that young people take the lead in it? In such programs.
All right. So the benefit is effectiveness of the program itself. So when we talk about youth issue, there should be youth engagement there. So youth leadership is really important, and I believe that all young people here is agree that young people know better about ourselves, know what we want, and also know what the problem we face it. And I will share about our advocacy journey in Indonesia. So in Indonesia, adolescents under 18 have challenges to access HIV services, and it also experienced by me. And at the time, my age is 16-year-old, and it's really hard to me to access HIV services because it's under 18, and the regulation at that time, Indonesia, for accessing HIV tests, it should be more than 18-year-old, and if you are under 18, you should bring the informed consent from your parents. And as a young population that have a lot of problem, so I can bring the informed consent. And also at that time, I haven't get my ID card yet because it's 16-year-old. And then finally, I can get testing of HIV. And then in the next year, I try again. So my age is 17-year-old, and then I can access, but yeah, it's still complicated. And I think it's also happening to my peers. So this problem should be addressed, and we are in Inti Muda trying to bring this issue to make an advocacy. So we are trying to reach out our Ministry of Health, and then making some advocacy, and we are meeting with stakeholders and bring them to bring this issue. And then finally, in 2022, the Ministry of Health make a new regulation about this. So the new regulations is allow adolescents under 18 to access HIV services under 18 without informed consent from their parents. So it's, thank you so much. So yeah, I think this is the advocacy works, but also the journey is not stopped there. There is obstacle and also many challenges that we face it.
Thank you so much. Nothing without us. Nothing for us without us. Basically, that is what I'm getting, especially when it comes to leadership or involving us in programs such for us. So, but I want you to share what are some of the setbacks that you faced, yeah, challenges, yeah.
So yeah, after the regulation is there's still challenges that we have to face with. So the first one is this regulation is not distributed well to health services. So Indonesia is a big country. There's hundreds of health services. So yeah, at this time, it's still under process. We encourage Minister of Health to make some socialization to health services in Indonesia. And the second one is there's still healthcare workers that not friendly to adolescents and young people. And also outreach worker that they cannot do outreach to adolescents under 18-year-old. And what we do to face it is we develop some module and guideline. We made some guideline about outreach adolescents under 18-year-old. So this guideline is basically talking about how to approach adolescents under 18-year-old and how to communicate with them, how to reach them to health services. And after we build that guideline, we also make some workshop for health service healthcare workers and also outreach worker. So this workshop is basically aimed for make them sensitized about adolescents under 18 and how they can make a good communication with adolescents under 18. And also the obstacle and challenges that we face is the new penal code, the new criminal code in Indonesia. There is an article that talking about contraceptive. So this is so sad for me because the rules say that everyone who show contraceptive to children, it will be punished. And then also there's exception there, but I think the problem is there is no exact rules that should be addressed because it potential to criminalize people, especially outreach worker. Because yeah, as you know, outreach worker can bring condoms and show it to adolescents or children for education, but in this penal code, it's not talking about that. So we are Inti Muda and other organizations in Indonesia still bring it up to still make sure that this regulation can be removed. So yeah, thank you so much.
Great. Thank you very much, Bella, for that, and thanks for sharing. It's very interesting that the same issues that the young people raised this morning with the First Lady are still the same issues that are happening across many seas and beyond. And thank you to your network and for you for contributing largely to the response. And now finally to our final panelist who's sitting right beside me, Siyabonga. Please do share with us, as a young social accountability and monitoring champion, you strongly advocate for strengthened evidence generation for accountability through the MOBI SAF-AIDS application. What are some of the barriers proper SRH service provision to young people?
Thank you. There are quite numbers of barriers we face on the ground that hinder the prosper for enhancing that the youth have got access to the SRH programs. I will just elaborate much of them. Firstly, the lack of privacy and confidentiality. The commonly identified barrier related to the healthcare providers is confidentiality breaches, disrespect and discrimination of adolescents, which prevent adolescents from accessing SRH services. Secondly, the community stigma. When young people think of visiting a health care facility for SRH reason, the thing that comes into mind is what the community talk behind their backs. Once the community defames you, it's really difficult to convince people who you are. If you are seen going to the hospital to access the SRH service, it's like you are engaging in sex. So society will have a particular perception of you. So young people prefer not to go to the health facilities to access SRH just because of the community stigma. And the community attitude such as rumors of prostitution for adolescents who access sexually health services also hinder adolescents from accessing SRH services. For instance, most community members believe that SRH services was for married and young adults, and it was unacceptable, and the behavior of bad girls, if unmarried, access the services. This kind of community attitude further challenge access to adolescent SRH services. Due to this reason, most adolescents did not want to be seen around SRH clinics due to the association of adolescents SRH services with sexual activities, which were sometimes labeled as a bad manners. Poor programming of programs. NGOs take services to the people. They do not ask them how the service should be rendered. For instance, sex workers want mobile clinics to go in their hotspots, while we just want them to go to facilities like anyone else. To me, advocacy has to do with services improvements based on the gaps that you have identified and having voice that can impact change in the society. It's also about stewardship. As a young person in my space, I can safely represent people living with disability because I have collected their advocates' agendas. I can represent the LGBTQI community and advocate for their rights and equal access to SRHR. Although I am heterosexual man with just one partner, to me that is advocacy. We can break barriers hindering advocates by meaningful engaging young people in their spaces and ensuring participation on policy reviews, on formulation of laws, guiding their movement, always put young people in the forefront. However, there are some steps that have been taken just to overcome these barriers, which is useful, which is the MOBI SAF-AIDS app that is being installed on Android phone, and it's easy to access it, whereby the young people, they got opportunity to just write anything they want or report anything to the app so that the healthy leaders, they can read at the app, then came back with the feedback. Thank you.
Thank you very much, Siyabonga, for that. And thank you so much to all the panelists for really highlighting some of the tremendous work done by yourselves, your organizations. I would like to ask you to keep us company here very briefly as we invite our next abstract presenter, who is also going to be the session that we're closing with. Help me welcome Dennis Banda from Zambia. Dennis is going to be sharing with us an abstract on youth-led football approach to improve HIV outcomes amongst young people in Abidjan and provide insight on how adolescent boys who adhere to harmful gender norms manage their sexual health. Dennis, you have very few minutes.
Thank you, Crystal. I'm sure I've never been greeted so many times in a day, but otherwise, let me say good afternoon as well. Thank you. Yeah, so to get into our research that we conducted, a brief background, where we work. Okay, so we are currently working in East Africa, West Africa, and Southern Africa. And the research that you're going to hear today is primarily focused on the research that we did in Ivory Coast, in West Africa. So the research is called Community-Led Monitoring, which is a paper-funded project for 12 months and is being implemented in Abidjan, Ivory Coast. The aim of the research really was to understand the comprehensive HIV knowledge for young people and also explore concepts of gender and its possible impact on young people's sexual behaviors. So the research targeted young people between the age of 10 to 18, and also, like I said, exploring the issues around gender and the place where it was conducted. As TACO, what do we do? So we use football as a vehicle for social change in engaging young people in their sexual health in a way that they will remember, enjoy, and also understand. So a simple equation, as you can see. Okay. So our findings from the actual research, from the implementation of the project, initially we trained 24 young leaders as peer coaches, who then reached out to 620 adolescents. Of that number, 31% were female. We were able to deliver 271 HIV football sessions, and you can see from the graph the improvement in knowledge from baseline to session 10 and also respectively to say after session 17. So 70% increase and also 83% increase in knowledge. So the data that we are going to present to you, with the help of a PhD student, we developed and piloted a new qualitative research in which we trained community coaches who live in Abidjan and understand the issues that affect them around HIV. The coaches then conducted a semi-structured interview with their young players, and in this particular research, we use what we call research by coach. After the research was conducted, I think we also were able to use what we call a story completion method. So the story completion method is a method recognized in research and is particularly useful in drawing out norms and values around social phenomena, especially if it's too sensitive a topic to ask direct questions. So for example, from this drawing, you could see that it's a discussion and we pick points or questions that focus on words, thoughts, and interactions. Some of the questions that we ask in this research to draw out these thoughts and reactions were highlighted in green. Okay. We believe that M&E should not only gather information about a program, but it should also be an opportunity to understand perceptions and perceptions of coaches and also the program recipients in a quest for local relevance, sustainability, and community ownership. So this image that you're seeing summarizes some of the steps that we use. The steps might vary depending on what we want the outcome to be, but usually these are the steps that we are going to take in the research. So some of the results from the research was concepts such as Mogapo, that they exist in Ivory Coast. So Mogapo is a Ivorian jargon which refers to a group of young people that have multiple sexual partners and use lies to control their partners. And after the first sexual encounter, they leave these partners. So we discovered that those things exist. Also, the second outcome or finding was that the motivation for these young people, sexual practices, is to stand out amongst their peers and also maintain that status among their peers. The other motive, there was also a clear comparison made by respondents between masculinity and Mogapo and sexual domination, and also encourage that sexual domination and violence was encouraged amongst these groups. Okay. The other results that we found was that Mogampons, or these young people that belong in these groups, do not use condoms and also are afraid to access HIV services, which is quite alarming for young people to engage in. So in winding up, we are saying football drills with inbuilt HIV messaging have proven effective in increasing adolescents' comprehensive HIV knowledge. And we're also saying from the learning from the RBC study, it has led us to focus on the next steps or intervention on addressing issues of toxic masculinity and also these groups like Mogampon, and also target adolescent HIV prevention in Ivory Coast. So, like I said, this project was a 12-month project, and we've submitted an extension, and hopefully we can keep learning from this and see how best we can do targeted programming for these young people. So the RBC study focuses, or just helps us to understand the value of what we can get out of the programming. Thank you so much.
Thank you very much, Dennis, for that, and thanks for keeping within the time. Another round of applause for Dennis, please. So, colleagues, I do realize that we're 2 minutes over time, but if you'll just allow my panelists just one round, just 1 minute, 1 second sentiment on what is that one impact that you're proud of as a result of your advocacy. Very brief, very short. You can jump in. What's that one thing that you're proud of as a result of your advocacy? What's that one concrete impact? Yeah, we'll see if we can take maybe 1 or 2 questions from the audience.
So I am proud that the Ministry of Health of South Africa and the other key organizations have taken charge to amplify their voices around the advocacy of quality treatment, and they now have realized the importance of advancing their treatment and advocating for the most optimal and quality drugs in South Africa. Thanks.
Thank you, Nyiko. A round of applause. Anyone else want to jump in quickly?
All right, for advocacy, I guess it's really important to collaborating to make more impactful work. Thank you.
Wonderful, thanks, Bella.
My impact has been to enroll treatment interrupters back into care. Thank you.
Perfect, wonderful. Ndilo.
All right, so with mine, I'm proud of our clinic because now we know at least we can be at the forefront of healthcare service delivery, and we are not just another Twitter fingers. Thanks.
Thank you very much.
Thank you. Mine that I'm proud of is that now in my community, I have seen quite numbers of young people flocking to the health facilities to access SRH. Thank you.
Wonderful. Thank you very much. A round of applause to the panelists, please. If you have any questions, can I see how many questions we have in the room? 1, 2, 3. And they're all from young people. 4, 5. Any other? 6. All right, so you see the panel that is right in front of you, ne? And the people that are sitting just right next to you, they're also very young individuals who have worked really hard to be here. Some of them are going to be presenting in various sessions, various abstracts. Please interact. These are your base resource people, but then there is more. Because of time, I'm being looked at like, you know what, it's time. Kindly pardon us, but we will be around. Please feel free to ask questions. Before I close, I'd like to first of all, a round of applause for the panelists again. Why are you sad? A round of applause for the panelists, please. Yay! That's more like it. That's more like it. And now, as we started by mentioning that this session was brought together by the Youth Reference Group, the global network of young people living with HIV. But one thing that I did not mention was that this session was sponsored by the United Movement. How many have heard of the United Movement? Yo, guys, you're failing me. You were there yesterday night. It sponsored the dinner. How many have heard of the United Movement once again? So what happened yesterday was that we were not able to sign up because the QR code was there, but then the Wi-Fi was not working. So as we take a few minutes, as you clap for us, as we get off the stage, please take a minute to sign up for the movement. This is for the young people in the room. Thank you very much. It has been a pleasure. Thank you, thank you, thank you.